This Medical Devices Center is an example of a phenomenal cooperation between the Institute of Technology Dean and the Dean of the Medical School. They have a common vision for having engineering faculty and medical faculty work together. In fact, we're beyond the medical school and we're working with the dental school and several other schools within the health sciences as well. The goal of the Medical Devices Center is to be a training program for the next generation innovators in medical device design. We want to show them by hands-on training on real needs how to do device development. Dr. Manga had invited me to stand by in the surgery room while he was doing a variety of surgeries. He was taking some biopsies, and the amount of material that was coming out from the forceps was very small, so he was going in back and forth about 12 times. I asked him, well, would it be useful to be able to have larger volumes of tissue instead? He said, yes. I had been teaching a class on advanced mechanisms, and Judd was in the class. He also was looking for a master's project. Dr. Manga opened up a number of times where Judd went in, watched the same surgery, asked lots more questions to get more detailed answers.
The devices that we pass through the scope on the outside have a mechanism to open and close, and then at the tip it has either a basket or in this case a biopsy. And you'll appreciate that this biopsy is very tiny. Sometimes the sample is too small for them to be able to tell us what the pathology is, and that's the main goal of our new design, is to be able to get a bigger sample. The reason these instruments are so small is because they have to pass through this tiny working channel. If one were to focus on the tip of this scope, you would see there's a lot of stuff that has to go through this. There's light sources, there's fiber optic cables, and that leaves only a very small 1 millimeter channel to be able to pass instruments.
As Judd came up with concepts on paper, he would go over and pass those by Dr. Manga, get feedback. As he developed computer prototypes, renderings, he also got feedback, so that by the time the final prototype was developed, Dr. Manga had been involved in the entire process. This is a perfect way to do medical device development. The university has so many aspects of medicine. And the missing piece really was the early prototyping and trying to come up with innovative new solutions for problems. And this is the place that we can attack those problems. We only had a limited budget, and right away we had donations from major companies like Medtronic, St. Jude, Boston Scientific. Several times, for example, Boston Scientific engineers showed up with a trailer full of devices. We are so grateful to these companies and also to individuals who have stepped forward to help us with funding. Wouldn't it be wonderful to have devices come out of this center that we can point to and say, that saved my life, or that extended my life, or that took pain away from my loved one?